No, no, but Doc,
Yes.
I know that for experience, you must have to deal with numbers.
Yes.
So what were the critical figures for you? I mean, to when you were going to confront this? I mean, how bad was it? Okay, and then let's profile it across the country. How bad, how terrible that you now said to yourself, we must have to deal with this.
Okay. Demographically,
Yes.
young people between the ages of 10 and 24 form 30% of Nigeria's current population.
Okay.
If you look at the population of Nigerians, because there's a national youth policy that pegs the age at 35.
Yes.
So if you look at people from age 35
down
and below, they make up over 70% of Nigeria's population.
That's almost 100 million, over 100 million.
And that's the issue. And then when we looked at age of initiation of sex, we realized that because of some improvement in nutritional status and the rest, young people were maturing
earlier
and
faster.
And because there was a gap between their physical appearances and the societal response in terms of their cognitive abilities and their social context, we realized that a lot of young people, the age of initiation of sex had dropped. In fact, right now, we are looking at anything between 13 to 15 years.
Now, that is alarming.
No. You see, this is the point. Now, some people argue and say, but some of these girls are having this in marriages. You know, some adolescent girls are married.
Yes.
And they are saying they are having sex legitimately because they are married.
But they are underaged.
But we keep reminding them that if the whole world has adopted a convention on the rights of the child that says that anybody below the age 18 is a child, anybody therefore who marries that girl that is below 18 is marrying a child and is asking a child to mother another child. First, you are depriving that child her childhood. Because you see, in childhood, there are things we do. Our right to play, our right to association, our right to education, our right to health, our right to be informed, our right to a name. She has not even gotten used to her name, to know the import of her name, to even understand the history behind her name or his name.
So she's lost her identity already.
And then you probably then, because she doesn't even have the capacity, the cognitive capacity to go into marriage at that age, because she doesn't understand what it means. Yes, her body is ready. She's not economically viable. She's not being trained for anything to sustain herself. And then, whoop, she pops up with a pregnancy. What happens? First, what is her health-seeking behavior? She has a very poor health-seeking behavior. Two, her risk perception, very low. So when you say, come to antenatal,
she doesn't understand what's that.
Every week, you want me in that place.
To do what?
I go in the morning, I queue, I spend the whole day, I'll come back. I don't understand. You know, and because she's not cognitive, she's not prepared cognitively, what level of information can you give? Those of us who are involved in working with young people, and you may ask any classroom teacher that is trained, they will say you must work with the child according to evolving capacity. Which means that if a child is 12, I cannot give to her a knowledge of an 18-year-old, because the mind of a 12-year-old is totally different. Her expectations of life and her context is probably different. You know, so there are many issues that this throws up. But the issue is this: young people contribute significantly to the high incidence of maternal mortality in Nigeria.
That is the question actually I wanted to come to. The question of, morbidity now.
Let's start with
so we are now saying, therefore, that we are more or less if you're not careful, if you're not doing the right thing, asking the right questions, and leading the way out of all this, we are more or less pushing these children to early death. Is that what we're saying?
Of course. Of course. You see, when we talk about all of this, we look at the roles and responsibilities of duty bearers.
Parents, teachers, government.
Everybody. All the significant adults and institutions that have responsibilities to young people. We are all guilty of
Negligence.
not doing what we ought to do, when we ought to do it, and how we ought to do it. And I will tell you something very clearly. Nigeria as a nation, after about 10 years, it took us 10 years of advocacy, that we led with some other civil society organizations in Nigeria, working in collaboration with the Federal Ministry of Education, using the national education structure, getting approval at the National Education Council. There is a curriculum that is meant to guide the growth and development of young people in this country. It is called Family Life HIV/AIDS Education.
Family Life HIV/AIDS Education.
And we are only looking at in-school population at this time. We are not talking about
the out school.
Out of school. And even as I speak, even though the curriculum for in-school is at junior, lower primary, upper primary, junior secondary, senior secondary, the effort at implementation has only been intensified at junior secondary. But even when we did the national assessment of that effort with the Federal Ministry of Education taking the lead, in fact, they went around the whole country, we realized that implementation was uneven across the country, from something like 7% to about 55%.
7%?
To about 55%, because there are parameters that guide effective implementation. If you also look at the health sector, Nigeria has a national policy on adolescent and young people's health and development, with a framework, implementation framework and all of that. Beautiful.
On paper.
On paper. But when it comes to interpreting the spirit of that document, Nigeria is at the starting point. We have seen what I call scattered thunderstorms, or droppings of efforts. No access to youth-friendly health services across the nation. I'm coming. Now, when we look at access to education, because education is the key changer, is the game changer. You and I know.
Yes.
The last UNESCO figure was about 10.3 million.
Yeah.
Nigerian children who ought to be in school
but are out of school.
That is greater than the population of Benin Republic.
10.3 million.
It's about half the population of Ghana. And that is what we are sitting on. And then you ask yourself, how do you get these children back into school? When we have an enabling law, the Universal Basic Education Act, that insists that up until the end of junior secondary school, every child should be in school.
Yeah.
And there are things that government has agreed to provide to those children.
To get them into school?
Yes. Instructional materials, free lunch per child per day, and all of this. Yet it's not happening. So you then begin to ask, that what is wrong with us? Is it that we say what we don't mean, or we don't invest appropriately
in the things we have said?
Right. And it's not money, about money. Are we ready to do what it takes to make a difference to the lives of these young people? Do you know the downside of what we are not doing? Your old age, my old age is not guaranteed. Because